Let's talk today about which activities are allowed after hip replacement surgery. So if you are planning to undergo a hip replacement surgery, you must be definitely having questions regarding what your life is going to be after hip replacement surgery. So first of all, let's start with walking. Normally, your physiotherapist will guide you, but you will start walking within a day of your surgery, either by putting full weight on your operated leg or partial weight. Initially, you will be walking with a walker, then you will be shifted to a stick, and finally, you will be walking independently between 4 to 6 weeks. Now, coming to other activities like driving a car, sitting in a car, playing golf, high impact activities, going to bathroom. So let's first start with sitting in a chair. When you will be sitting in a car for the first time, that is on the day of your discharge, you are expected to sit in the front passenger seat of the car. There also you should recline your seat slightly and keep your legs away or apart. That is how you should sit in your car seat initially. You will be allowed to drive a car between 4 to 6 weeks when your pain has gone down significantly, you are comfortable. So between 4 to 6 weeks, you can start driving your car. If you want to play golf, that you can start around 6 weeks to 8 weeks. Cycling, you can start around 4 weeks. But initially, when you will start cycling, make sure that your seat is high. High seat means you should raise the level of your cycle seat. You should use a low resistance cycle initially. Also, when we talk about sitting cross-legged or full squats, that you should definitely avoid. But for first 3 to 6 months, you should definitely avoid sitting cross-legged or sitting in squatting position. Initially, when we talk about exercises, your physiotherapist will start you on ankle pump or quadriceps exercises in the hospital itself. For the first 2 weeks, it will be only heel slides and straight leg raising if your doctor has cleared you for that. Then comes the cycling part, which usually we start around 2 to 6 weeks depending on patient's comfort. Swimming, we normally start after 6 weeks when your wound is completely healed. Driving, you can start around 4 to 6 weeks. If you are in desk job, you can start it around 2 to 4 weeks. If you have a standing job or a light duty, you can start it in 4 to 6 weeks. Heavy manual work, you can start after 12 weeks only. Normally, we do not recommend heavy manual work to our patients because that helps in increasing the life of the implant. If you want to travel in a flight, you can travel after 4 to 6 weeks, and you should wear compressive stockings when you are traveling in a plane, and you should keep yourself well hydrated. And after coming out of the aircraft, you should definitely walk for some period so that the blood flow is maintained very well. So this is a bird's eye view of how your life or how the activities of your life are going to be after your hip replacement surgery. If you have any more doubts, feel free to contact us on the number shown below. Thank you.